If you Google, "why am I tired all the time?" you will find an endless list of answers, anywhere ranging from gut health to hormones to vitamins and supplements. The problem is that Google gives you an endless list of solutions, but there's no way of knowing which one is relevant to you. That is the gap that I want to fill in on this video. Hi, my name is Dr. Karthik Oreppan, and I had a medical condition that was undiagnosed for many years until I diagnosed it myself in medical school. And since then, I've always had the passion to help patients with hard to diagnose conditions or even common symptoms that are hard to put your finger on. I've been on both sides of the exam table, and I know how intimidating it can be to receive a lab report and be confused as to whether you should feel reassured or more anxious. In this video, we will talk about the causes of fatigue that show up on blood work. My goal today is to give you a clear framework and understanding of the root causes of fatigue so that on your next conversation with your provider, you can feel confident. By the end of this video, you will have a list of the labs that are typically done for patients with fatigue so that you know you're not missing anything big. Stick around until the end because we will talk about hot button topics like low testosterone and menopause that could be driving certain symptoms. The goal here is not to do more and more tests, but to do the right tests at the right time, or what I call the Goldilocks zone. So let's get right into it. We typically start with a complete blood count, which is the CBC, which is the hemoglobin, the platelets, and the white cells. The hemoglobin is what carries oxygen in the blood. It makes sense that the less hemoglobin you have, the less oxygen that is delivered to your tissues, causing you to feel tired. The common name you probably heard for this is anemia, which is low hemoglobin. One thing that can be missed on a complete blood count is actually the iron levels. Iron is a component of hemoglobin, and low iron by itself, even if you have normal hemoglobin, can cause fatigue. The two tests that doctors typically use to assess how much iron is stored in your body is the ferritin and iron saturation. One other thing that could show up on a complete blood count is actually blood cancers. It's rare, but it's possible. That's why it's always a good idea to be up to date on cancer screenings such as colonoscopies and mammograms. The next test that is very common is called the Comprehensive Metabolic Panel, which is all of your electrolytes, your kidney function, and liver function. For example, high or low sodium, very high calcium, and very abnormal kidney function or liver function can all contribute to fatigue. These causes are rarely missed because they're routinely tested for. Next up is a juicy topic of hormones. There's a couple hormones that we will cover here. The first one is a thyroid hormone. This is very commonly Googled. The thyroid gland is a gland in your neck that secretes thyroid hormone, which regulates metabolism throughout your entire body. High or low amounts can actually result in all sorts of disturbances like feeling cold, dry skin, hair loss, and you guessed it, low energy. You have to be a little bit careful here in terms of attributing your symptoms to abnormal thyroid function. I have a lot of people who ask me questions when their thyroid function is slightly off. Slightly off typically doesn't result in fatigue, and this is where you really have to rely on your provider's knowledge and experience. We all have the information out there on the internet, but really the experience and the knowledge is what will guide the interpretation of your lab test. Typically, if the thyroid function is slightly off, that doesn't mean that that is the cause of your fatigue. Again, this is very nuanced, and this is something that you want to rely on your provider's input for. The next hormone that is very vital to life is the cortisol. It's produced by the adrenal glands, which sit right atop your kidney. You've probably heard of cortisol in the context of stress, but that is high amounts of cortisol. Low cortisol can cause vague symptoms like fatigue, and that is why it's important to check for it. The caveat here is to make sure that your cortisol is checked in the morning. Why is this? Cortisol levels actually fluctuate throughout the day, and it's actually highest in the morning and then decreases as the day goes on. That is why checking the cortisol in the morning is the key to uncovering whether or not there is a deficit. So if you've already had your cortisol level checked, the key idea here is to check the timestamp or when that cortisol was drawn and make sure that it was drawn before 10 a.m. for most accuracy. Testosterone is another area full of myths. You've probably seen those ads that hit the TV in the early 2000s that basically had every man asking their doctor to have their testosterone level checked. It packaged general symptoms like fatigue, and it hit men where it hurts, their vitality and their sexuality. It's true that low testosterone can cause fatigue, but it typically causes other symptoms. What happened in those commercials, and that continue to happen today, is called disease branding, in which marketers package general symptoms and present it as an easily treatable condition.
After I turned 40, it wasn't easy to keep up. Everything changed. My energy, my drive. Then I found
That is why testosterone is a blockbuster drug. And I see patients every week from a longevity clinic on testosterone when they actually don't need it. Clinical guidelines, for example, from the American Urologic Association and endocrine societies only suggest testing for testosterone if there's other symptoms like infertility or low libido, in addition to low energy. But again, here, the psychology behind marketing typically beats clinical guidelines every single day. If you are experiencing low energy, it's very important to have an open discussion with your provider on whether or not testing for testosterone is appropriate. Again, we're trying to find the sweet spot between too many tests and not enough tests, because too many tests can also be harmful. For women, the opposite can be true. In menopause, estrogen levels can actually significantly decrease. That leads to symptoms like hot flashes. And it's actually the gold standard treatment for these symptoms is actually hormone replacement therapy or giving back estrogen. There's much more evidence to support this practice that it is safe for most women. So again, this is something that you want to talk specifically with your provider about. Rarely, there are certain infections in which their only presenting symptom is fatigue. Symptoms like HIV or hepatitis B or hepatitis C could be raging throughout the body, but maybe the only manifestation is fatigue, and it is worthwhile checking these. Most primary care physicians will typically screen for this even without symptoms. Vitamins are vital, but not all vitamins need to be checked. It's unclear if there's a direct causal relationship between vitamin deficiency and fatigue, but two common ones that I typically check in patients are vitamin B12 and vitamin D deficiency. It's worthwhile checking those. I remember one woman's vitamin B12 was so low that it was actually causing numbness in her feet. She had been told again and again that it was because she was getting older. This is by no means an all-inclusive list, but it's the basic tests that most doctors would consider for someone coming in with fatigue. And so here it is. Feel free to screenshot it, save it, refer to it, send it to someone that is suffering from fatigue. My goal on this channel will always be to help you feel better, to understand how doctors think, and to understand how the medical system works. This not only means that you make sure you get the right tests, but that you don't get unnecessary tests, that you don't get over-tested, because over-testing can be just as harmful as under-testing. We're really looking for that Goldilocks zone of testing. If there is a test that you think that you're missing, simply ask your provider. Next week in part 2, we will talk about fatigue that doesn't show up on blood work, like long COVID and sleep apnea. So I'll see you then on the next video.